So we talked about the two hormones secreted by the acidophils, growth hormone and prolactin. Now let's see which are the hormones secreted by the basophils. उसे analyze करते हैं. Now you have the thyroid stimulating hormone TSH, also called as thyrotropin. So if you remember, all pituitary hormones are called as tropins. Growth hormone was rightly called as somatotropin, and you had prolactin called as mammotropin, also called as lactogenic hormone or eutotropin. So that's a tropic hormone. Similarly, thyroid stimulating hormone is called as thyrotropin. It is secreted by the basophils, which is by the thyrotropes of the pars distalis. What does thyrotropin do or TSH do? It regulates the growth of the thyroid gland. A child is born with a small thyroid gland. As his age increases, TSH stimulates the thyroid gland to grow in size and reach the adult size. And thyroid stimulating hormone increases the production of thyroid hormones, thyroxine and triiodothyronine. In other words, T4 and T3 hormones are secreted with the help of TSH. And secretion of TSH is controlled by hypothalamus called as thyrotropin releasing factor. TRF, thyrotropin releasing factor, controls secretion of TSH. The hyposecretion of TSH causes less secretion of the thyroid hormones, that is hypothyroidism. तो hypothyroidism, TSH कम हो जाएगा, T3, T4 कम हो जाएगा, and we have done it before, causes hypothyroidism, cretinism in children, and Gall's disease or mixed edema in adults. And a hyposecretion also causes an atrophy, which is degeneration of the thyroid gland. Thyroid gland, to maintain its normal size, requires TSH. So TSH कम हो जाएगा, size of thyroid gland will decrease. It degenerates, which is called as atrophy of the thyroid gland. And a hypersecretion of TSH causes increased production of thyroid hormone, a condition called as hyperthyroidism. So oversecretion may too much T3 and T4 are given out, that causes hyperthyroidism, which we remember causes exophthalmic goiter. So this is about thyroid stimulating hormone. We have done it in thyroxine, thyroid gland already. And then we have a crucial hormone, adrenocorticotropic hormone, ACTH, or corticotropy. So ACTH also called as corticotropy. It is secreted by the basophils, corticotropes of the pars distalis. And where will it act on? ये है आपका kidney, and kidney के ऊपर ये है adrenal gland. Middle part is called as the medulla, and surrounding it is called as the cortex. And ACTH from the pituitary gland acts only on the adrenal cortex, and adrenal cortex will give out three hormones. If you remember, aldosterone, it will give out cortisol, and it will give out androgens. So you have aldosterone, you have cortisol, and you have androgens given out by the adrenal cortex under action of adrenocorticotropic hormone. No doubt the hormone is adrenocorticotropic hormone. attacks only on the adrenal cortex. And all the three hormones, aldosterone, cortisol, and androgens, what will they do? Aldosterone helps in the regulation of salt, sodium, and potassium level. Arif sir has just taught you aldosterone helps in the reabsorption of sodium and secretion of potassium into the distal convoluted tubule. So sodium levels in the blood will increase and potassium level will decrease. So salt का regulation होता है and water balance, osmoregulation. आपके ब्लड में जितना सोडियम वापस आ जाता है ना, sodium is a osmolyte. Sodium increases your water retention in the body and increases your blood pressure. So by reabsorbing sodium, your water is retained in the body and your blood pressure will increase. What is maintaining a salt and water balance called as? A salt and water balance is called as osmoregulation. So which is the chief hormone concerned with osmoregulation? Aldosterone. And because aldosterone maintains salt balance, it is rightly called as a mineralocorticoid. Mineralocorticoid. Corticoid means these are cholesterol derivatives or fat derivatives. So all the hormones of the adrenal cortex are corticoids. They are fat derivatives. इसके पहले हमने जितने भी hormones किए थे, most of them were proteins or amines. Thyroxinic amine था. बाकी जितने hormones हमने किए, you have thyrocalcitonin, or you have PTH, parathyroid hormone, it's a peptide hormone, growth hormone, prolactin, all are protein hormones. Thyroxine is an amine hormone, but adrenal cortex hormones are fat derivatives which are called as corticoids. So, तीनों hormone, aldosterone, cortisol, and androgen sex hormones are chemically fats and are called as fat derivatives, also called as cholesterol derivatives. तो ये fat या cholesterol derivatives होते हैं. And aldosterone is a corticoid and it helps in regulating sodium potassium balance, mineral balance. Mineral balance, so it is rightly called as a mineralocorticoid because aldosterone helps in regulation of salt, sodium, potassium balance, mineral balance. It is called as a mineralocorticoid. So, which is a mineralocorticoid? Aldosterone. Which hormone helps in osmoregulation, salt and water balance? Aldosterone. Then we have glucocorticoid cortisol. It regulates carbohydrate metabolism. It controls your blood sugar level. Cortisol increases blood sugar levels. Cortisol blood sugar level increase करता है. More cortisol, more is the sugar level. And it will help in gluconeogenesis, conversion of glucose from amino acids. Protein से sugar बनता है. If you remember, thyroxine helps in protein synthesis. Growth hormone helps in protein synthesis. It is cortisol which will not anabolize protein, it will catabolize protein. it will break down proteins into sugar. So समझो there is extreme starvation. If you remember, Marasmus बच्चा है, he is malnourished, उसके बॉडी में बिल्कुल खाना नहीं जा रहा है. Your brain requires at least 20% of your sugar supply that you eat per day. तो ब्रेन को वर्किंग के लिए शुगर की जरूरत है ही है. हाइपोग्लाइसीमिया होगा, ब्रेन विल नॉट वर्क. तो एक्सट्रीम स्टारवेशन में, स्ट्रेसफुल सिचुएशन में, your pituitary gland gives out ACTH, your adrenal cortex gives out glucocorticoid cortisol, and cortisol will break down proteins. आपके मसल्स को ब्रेक करेगा, एक्टिन मायोसिन को ब्रेक करके अमाइनो एसिड्स बनाएगा, and amino acid become pyruvic acid. Pyruvic acid undergoes reverse glycolysis to form glucose, and blood glucose levels are increased. Blood glucose levels are increased. So cortisol helps in direct increase in your blood glucose levels. ये याद रखना. So that is the reason it is rightly called as a glucocorticoid. And androgens, which are sex hormones. Sir, females में there is mustache, there is beard. ये females में होता है. Sir, who brings about mustache and beard? हल्का सा hair on the face, in the beard region, pubic hair develop होता है, armpits में hair develop होता है. तो ये armpit का hair, pubic hair in the penis region, mons pubis region, all these are secondary sexual characters brought about by androgen, sex hormones of the adrenal cortex. Adrenal cortex से होता है ये. And in humans, ACTH stimulates pigment cell melanocytes to secrete melanin. ये एक reality है. In humans, MSH has no effect on pigmentation. Pigmentation पे ये effect MSH नहीं होता है. ACTH, Adrenocorticotropic hormone, helps in pigmentation. So ACTH stimulates the melanocytes to produce melanin and helps in skin coloration. Skin color is produced by melanin given by melanocytes stimulated by ACTH. But ये सिर्फ knowledge point of view से important है. According to the NCERT, who controls pigmentation? MSH. तो आपको ये सिर्फ समझने के लिए बताया है. But if they ask you in the NEET exam, who controls pigmentation? Your answer is MSH. But what is the reality? It is MSH is ineffective in humans. Our pigmentation is controlled by ACTH. But you will remember, MSH controls pigmentation. The secretion of ACTH is controlled by the hormone of the hypothalamus called as corticotropin releasing factor. So corticotropin releasing factor controls it. And hyposecretion of ACTH एक disorder होता है, causes atrophy of the adrenal cortex. ACTH कम होगा, adrenal cortex atrophy, degenerate हो जाएगा. It leads to a disease called as Addison's disease. Addison's disease, in which there is weakness and fatigue. So, you remember cortisol increases blood sugar level. तो अगर cortisol कम हो जाएगा, तो blood sugar level will become less and there is weakness and fatigue. And sodium levels may decrease. If you remember, less ACTH means less aldosterone. Less aldosterone. So, yeah, less ACTH. So, less aldosterone. So less aldosterone. So in the nephron, the reabsorption of sodium and excretion of potassium will not take place. तो सोडियम reabsorb नहीं होगा, so blood sodium level will become less और potassium excrete नहीं होगा क्योंकि aldosterone is less, and that means blood potassium level will increase. So sodium will become less and potassium will become high. And low sodium levels cause hyponatremia, and high potassium level causes hyperkalemia. दोनों डेंजरस है. सोडियम ब्लड में कम हो जाएगा, your body will go into tremendous electrolyte imbalance, will immediately affect the brain, and you may go into a coma, comatose हो सकते हो. And excessive potassium hyperkalemia may act on your heart and make your heart rate become irregular. Too much potassium is dangerous for the heart. तो ये एक bad disease है, Addison's disease. Of course, it can be nowadays controlled, that if it is hyposecretion of ACTH, you can give injections of adrenocorticotropic hormone and prevent the conditions of weakness, hyponatremia, hyperkalemia, etc. It has been observed Addison's disease is associated with rheumatoid arthritis. So, arthritis called as rheumatoid arthritis, which is also an autoimmune disease. You remember like hyperthyroidism, जिसके अंदर antibodies attack your own thyroid follicle. Similarly, यहाँ antibodies attack your own joints, and your own joints are affected, which is called as rheumatoid arthritis, which is an autoimmune disease. So that is Addison's disease, which is hyposecretion of ACTH. The hypersecretion of ACTH leads to a disease called as Cushing's disease. Cushing's disease में there is obesity, moon face, buffalo hump in the upper back, abdominal fats, hyperpigmentation of the skin, and impotency in men. Sir, सबसे पहले कुशिंग में क्या होगा? Too much ACTH. Too much ACTH means excessive cortisol. Excessive cortisol. Too much cortisol will do too much protein breakdown. Too much protein breakdown. So, normally what is the sequence of breakdown of nutrient? पहले breakdown होता है carbohydrate, बाद में breakdown होता है fats, और last में break होता है proteins. ये normal है. Now, what will happen in a Cushing disease person? सबसे पहले कौन breakdown हो रहा है? Proteins. तो पहले protein breakdown हो रहा है क्योंकि cortisol levels are high. Then who will break down? Carbohydrates. And last में कौन break होगा? Fats. तो प्रोटीन और कार्बोहाइड्रेट इतने ज्यादा ब्रेक डाउन होते हैं कि फैट्स को ब्रेक होने की जरूरत ही नहीं होती है. तो फैट्स कीप ऑन एनाबोलाइजिंग क्योंकि प्रोटीन्स एंड कार्बोहाइड्रेट्स आर ब्रेकिंग टू प्रोवाइड एनर्जी. तो फैट रिजर्व एनाबोलाइज होते रहता है. इट कॉजेज ओबेसिटी. आपके फेस में फैट्स आ जाता है. दैट इज कॉल्ड एज अ मून फेस. आपका फेस ग्लोबुलर हो जाता है विद फैट्स. एंड अ बफेलो हम्प. आपके बैक साइड पे बफेलोज में कैसे हम्प होता है वैसे फैट्स डिपॉजिट होता है. एब्डोमिनल फैट्स. आपके ओबेसिटी एब्डोमेन में फैट्स बढ़ जाती है and causes hyperpigmentation of the skin. Remember, actually too much ACTH means too much pigmentation and impotency in men. So, too much ACTH, too much cortisol. too much cortisol, too much proteins are broken down. Protein catabolism. What is your penis made up of? If you remember, corpora cavernosa and corpus spongiosum are muscles made of proteins. So cortisol will break down the proteins in the corpora cavernosa and corpus spongiosum. And protein breakdown in the penile muscles means the penis cannot undergo an erection, and if a penis cannot undergo erection, that is called as impotency. तो ये impotency होती है. So what is the hyposecretion of ACTH called as? Addison's disease, जिसमें weakness, fatigue होता है, and you have hyponatremia, hyperkalemia. And what is hypersecretion of ACTH called? Cushing's disease, in which there is obesity, moon face, buffalo hump, abdominal fats, hyperpigmentation of the skin, and impotency in men. Very, very dangerous condition to have, the condition called as hypo or hypersecretion of ACTH. Chalo, so we have understood ACTH and analyze the two disorders, Cushing's disease and Addison's disease. Last two hormones are called as gonadotropics. You have FSH, follicle stimulating hormone. It is secreted by the basophils, gonadotropes of the pars distalis. In females, follicle stimulating hormone stimulates the growth of the ovarian follicle to form Graafian follicle and helps in ovulation. So we have done it so many times. Primordial follicle becomes primary follicle, secondary follicle, tertiary follicle, Graafian follicle, all the way to Graafian follicle along the secretion of, with the help of secretion of FSH. So FSH will help the growth of the ovarian follicle to form the Graafian follicle. Also, along with FSH and LH, FSH LH surge causes ovulation. FSH LH surge causes ovulation. Anything else that FSH does? It stimulates the theca interna to secrete estrogen. If you remember, theca interna layer hota hai, and FSH acts on the theca interna, and theca interna starts giving out estrogen. Theca interna secretes estrogen. So, estrogen is secreted by theca interna of the secondary and Graafian follicle under action of FSH. So, ये females में. In males, FSH controls the seminiferous tubule and formation of sperms, that is spermatogenesis. तो seminiferous tubule पे FSH act करता है and helps in sperm formation, spermatogenesis, and as a matter of fact, more specifically, if you remember, spermiogenesis. Spermatogenesis तो है, but spermatogenesis is mainly done by testosterone. FSH actually helps in spermiogenesis. ये याद रखना. And secretion of FSH is done by follicle stimulating hormone releasing hormone. Check it here. FSH RH. तो FSH भी डिस्कवर हो चुका है और follicle stimulating hormone releasing hormone डिस्कवर हुआ है. So अब तक हमने सब किया. Growth hormone releasing factor, growth hormone inhibiting factor, prolactin releasing factor, prolactin inhibiting factor, similarly corticotropin releasing factor. These are all factors, undiscovered hormones. But for follicle stimulating hormone, it is a releasing hormone. It has been discovered. And What is a deficiency of FSH do? It causes infertility in female. Sir, female में अगर FSH कम है, ovulation नहीं हो पाएगा and she cannot become pregnant. So that is called infertility. और males में FSH कम है, तो spermatogenesis, spermiogenesis नहीं हो पाएगा, तो sperms नहीं बन पाएंगे and that is called as sterility. So non-production of egg in female is called as infertility. And non-production of sperms in males is called as sterility. तो ये infertility और sterility female और male दोनों में होती है because of deficiency of FSH. And then we have LH, luteinizing hormone, also called interstitial cell stimulating hormone, ICSH. ICSH also called LH. LH also called ICSH is secreted by basophils, gonadotropes. In females, it brings about ovulation. If you remember, FSH and LH surge helps in ovulation, and as a matter of fact, which is the main ovulatory hormone? LH is the main ovulatory hormone. And after ovulation, LH stimulates the formation of the corpus luteum to release estrogen and progesterone. So estrogen progesterone secretion is done by LH. And in males, ICSH stimulates the secretion of male sex hormone testosterone from the testes. So testosterone secretion is done by LH or by ICSH, and testosterone, we remember, helps in actual spermatogenesis. So spermatogenesis is actually done by testosterone. LH or ICSH stimulates it. Hey, so what has LH or ICSH mainly done? Estrogen, progesterone secretion, testosterone secretion. In other words, it is associated with sex hormones. LH or ICSH is associated with sex hormones. Estrogen, progesterone, testosterone is done by LH or ICSH. And what has FSH helped in? FSH has helped in ovulation. In other words, egg production. And also helped in spermatogenesis. So, gamete production. Gamete production, for which reason it is called gametokinetic hormone. It is called gametokinetic hormone. So, which is the gametokinetic hormone? It's in egg production, spermatogenesis, FSH. FSH is the gametokinetic hormone, helps in gamete formation. And which hormone produces estrogen, progesterone, testosterone? Sex hormone production. Sex hormone production is done by LH, also called as ICSH. चलो, तो सर ये हो गए hormones. तो हमने कौन कौन से hormones किए सर? We talked about growth hormone. We talked about prolactin given by your acidophils. We talked about thyroid stimulating hormone, adrenocorticotropic hormone, follicle stimulating hormone, and luteinizing hormone secreted by basophils. So these were the 6 hormones secreted by the pars distalis. And now we have hormones of the neurohypophysis. So ये थे adenohypophysis के 6 hormones. Now we have neurohypophysis. You have antidiuretic hormone ADH, also called vasopressin, also called pitressin. ADH, antidiuretic hormone, also called vasopressin or pitressin, is secreted, I hope you remember, by the supraoptic nucleus of the hypothalamus. Supraoptic nucleus. and is transported to the neurohypophysis by the axon and is stored in the axonal bulbs, if you remember, as herring bodies, and is secreted into blood as and when required. What is the main function of ADH? It is a water retaining hormone. It increases the reabsorption of water from the distal convoluted tubule and collecting tubule. तो ये है आपका नेफ्रॉन एंड आपके नेफ्रॉन में से ये एडीएच एक्ट करता है एंड एडीएच एंटी डायूरेटिक हार्मोन reabsorbs water from the distal convoluted tubule, from the collecting tubule and from the collecting duct. And यहाँ से DCT से distal convoluted tubule से फिर ये straight part होता है which is called collecting tubule and collecting duct. इसमें से water is reabsorbed by ADH. Allowing urine formation is called diuresis. By reabsorbing water, it reduces urine formation, which is called antidiuresis. And the hormone is rightly called the antidiuretic hormone. It conserves water. By the way, where will this water go? Water will go into blood. Water will go into blood. तो ब्लड के अंदर the volume of water will increase. Volume of water will increase. As volume increases, volume is directly proportional to pressure. Volume बढ़ जाएगा तो pressure बढ़ जाएगा. More volume, more pressure. तो more volume, more pressure. And the pressure will increase. And your blood pressure will increase. So which hormone, by reabsorbing water, increases blood volume, and by increasing blood volume is directly concerned with increasing blood pressure? ADH. ADH increases reabsorption of water, increases blood volume, and increases blood pressure. So ADH by water retention increases blood pressure by increasing blood volume. And ADH also causes a rise in the blood pressure by contraction of peripheral arterioles, hence called vasopressin. आपके blood vessels को ADH contract करता है. ADH contracts blood vessels, so surface volume will become less. ये surface area will become less. What will happen if area will become less? If area will become less, pressure exerted will increase. So again the blood pressure will increase. क्योंकि volume is constant, but area कम हो गया है, so pressure will directly increase. So ADH is a great vasoconstrictor. ADH is rightly called as a vasoconstrictor. It causes vasoconstriction. Vaso means blood pressure, blood vessels, and constriction. So it causes vasoconstriction, and vasoconstriction, so it increases your blood pressure. So ADH by water retention will increase blood volume. And as blood volume will increase, it will cause increase in blood pressure. So water retention, more blood volume, more blood pressure, and ADH by vasoconstriction. By vasoconstriction causes blood vessels to contract. Causes blood vessel to contract, and the surface area becomes less. So again, the blood pressure will increase. So ADH is water retention also and vasoconstriction also. Because it retains water, it is called antidiuretic hormone because it causes constriction of vaso. Vaso means blood vessel. It causes constriction of vaso. It is called vasopressin, also called as pitressin. So which is the chief blood pressure increasing hormone? Which is the main hormone with increasing blood pressure? The ADH. Vasopressin increases your blood pressure. And then we have ADH secreted controlled by hypothalamus. ADH secretion is controlled by hypothalamus depending on the osmotic pressure of blood detected by osmoreceptor. आपके hypothalamus में there are receptors called osmoreceptor. And अगर बॉडी में पानी कम हो जाएगा और ब्लड वॉल्यूम ब्लड प्रेशर कम हो जाएगा, osmoreceptors, water receptors in the hypothalamus will analyze it. They will immediately give out ADH, and ADH will reabsorb water और आपका blood volume will come back to constant. What are the disorders? A deficiency of ADH leads to reduced reabsorption of water and thereby eliminates a large volume of dilute urine. This is called diabetes insipidus. तो सर अगर ADH कम है तो आपके distal convoluted tubule और collecting duct से water reabsorption will become less. If ADH is less, reabsorption of water becomes less, means more water becomes a part of urine, and urine में ज़्यादा water जाएगा, so diuresis हो जाएगा और antidiuresis कम हो जाएगा, and there is increased excretion of lot of urine. Too much urine is secreted, increased excretion of very dilute urine, and that is a condition called as polyuria. Polyuria, increased secretion of very dilute urine. And अगर बॉडी में यूरिन ज्यादा हो रहा है, पानी की कमी हो जाएगी, and hypothalamus will also have in it thirst center. करेंगे आप ये जब nervous system करेंगे, and thirst center will act on your of the hypothalamus, acts on your throat and gives you a parchy sensation, and you get increased thirst, which is called as polydipsia. So ये है polydipsia and polyuria, and that is called as diabetes insipidus. ये वर्ड सुना हुआ है, डायबिटीज सुना है, इंसुलिन डेफिशिएंसी इज आल्सो कॉल्ड डायबिटीज, बट दैट इज डायबिटीज mellitus. Diabetes mellitus is insulin deficiency, and ADH deficiency is called as diabetes insipidus. तो दोनों में डायबिटीज है. What is actually diabetes? Polydipsia, that is increased thirst, and polyuria, which is increased urine formation, is called as diabetes. तो जिनको डायबिटीज मेलाइटिस भी होता है ना, उनको भी यही प्रॉब्लम होता है. उनको इंक्रीज यूरिनेशन होता है और इंक्रीज थर्स्ट होती है, and that is called diabetes mellitus. But diabetes mellitus में, along with increased urine and increased thirst, there is also increased appetite. भूख बहुत लगती है, and that is the distinguishing feature externally. दोनों mellitus और insipidus में polyuria, यूरिन भी ज्यादा होता है, polydipsia, थर्स्ट भी ज्यादा होती है. तो आपको मालूम कैसे पड़ेगा ये mellitus का पेशेंट है या insipidus का, ये इंसुलिन डेफिशिएंसी वाला है या एडीएच डेफिशिएंसी वाला? जिसको इंसुलिन डेफिशिएंसी है उसको पॉलीयूरिया पॉलीडिप्सिया तो होता ही है, बट ही हैज इंक्रीज एपिटाइट ऑल्सो। हाँ, भूख बहुत लगती है डायबिटीज मेलाइटिस में। डायबिटीज insipidus has got nothing to do with food, so they have normal eating pattern and you diagnose whether it is diabetes mellitus or diabetes insipidus. And then we end with oxytocin or pitocin, secreted by the paraventricular nuclei of the hypothalamus and transported to neurohypophysis by axon. So it is given by paraventricular nucleus. ADH was given by supraoptic, oxytocin given by paraventricular nucleus. What does oxytocin do? It helps in fertilization by powerful contraction of the uterine muscles to drive sperms upwards into the fallopian tube. तो ये आपका यूटरस है और यूटरस के अंदर ये है आपका वजाइना, and oxytocin will act on the uterus and vagina. Oxytocin will act on uterus and vagina, and as soon as sperms ejaculate in the vagina, the oxytocin causes a slow contraction of uterus and a slow contraction of vagina, and then a sudden relaxation of the uterus and a sudden relaxation of the vagina. Slow contraction and sudden relaxation creates a suction movement of the sperms, and sperms get sucked. Hey, ये सुना हुआ है. This was done by prostaglandins. The very first lecture. Prostaglandins given by seminal fluid does it. And that was called, if you remember, reverse peristalsis. उसे reverse peristalsis कहते थे, and reverse peristalsis is done by both oxytocin and prostaglandins. Reverse peristalsis done by oxytocin and prostaglandins. They make the uterus and vagina slowly contract and then suddenly relax, which is called as reverse peristalsis, help the sperms to get sucked into the fallopian tube. Also, oxytocin acts on ejection of milk by contracting myoepithelial cells, hence called milk ejection hormone. Sir, ये है आपका, this is your breast, and you remember here we have lactiferous ducts, and here we have ampulla, and here we have mammary tubes and mammary lobes. And where is milk produced by alveoli? Where is it stored? In the ampulla. Milk is stored in the ampulla. And ये ampulla, ampulla के ऊपर special muscle cells are present. Special muscle cells are present. These cells of muscles are called as myoepithelial cells. Muscular cells are called as myoepithelial cells. Myo, muscle, and along with it, epithelium. So myoepithelial cells are present, and we have oxytocin acting on myoepithelial cell. So when a child is hungry, the child will start crying. It's a reflex action. The mother will bring the child near the nipple. The child will immediately suckle the nipple. तो बेबी को यहाँ ऐसे ऐसे आप करो ना, बेबी always takes the finger in the mouth. ये इसका reflex action है. तो किसी भी 1-2 साल के बच्चे को ऐसे ऐसे करो, it's a reflex action. तो भूख लगी, रोने का reflex action. बच्चा मम्मी को बोल तो नहीं सकता है भूख लगी है तो रोएगा, रिफ्लेक्स एक्शन। टच हिम हियर, reflex action, the nipple in the mouth, reflex action. And from the sucking, he will start sucking the breast. Immediately from the breast, a message will go to the hypothalamus of the mother, and hypothalamus will have paraventricular nucleus giving oxytocin. Oxytocin acts on the ampulla and acts on the myoepithelial cells, muscular cell, and muscular cells contract, and as muscular cells contract, milk will get ejected through the lactiferous ducts to the outside, and that will enter the child's body. So it is rightly called as the milk ejection hormone, also called the milk let down hormone, milk ejection or milk let down hormone. And oxytocin or pitocin brings about uterine contraction during childbirth parturition, so it is also called the birth hormone. तो ये birth hormone है, and it contracts the uterus. So during parturition कितना detail में किया है, oxytocin will act on the myometrium, and myometrium पे contract करेगा along with prostaglandins and estrogen, and will help in the ejection of the child out of the body, which is called as child parturition. So that is the birth hormone. तो ये ऑक्सीटोसिन इज एक्चुअली वेरी पावरफुल कॉन्ट्रैक्टाइल हार्मोन. वो यूट्राइन कॉन्ट्रैक्शन के पावरफुल कॉन्ट्रैक्शन से रिवर्स पेरिस्टाल्सिस से फर्टिलाइजेशन करता है, वापस यूट्राइन कॉन्ट्रैक्शन से चाइल्ड बर्थ या पार्चुरेशन करता है, बाय कॉन्ट्रैक्टिंग मायोएपिथेलियल सेल मिल्क इजेक्शन करता है. सो ऑक्सीटोसिन इज प्राइमरीली अ कॉन्ट्रैक्टाइल हार्मोन. Does it have any other to function to perform? In males, its function is not well defined, but psychologically, oxytocin has been defined as the love hormone. So, sir, whenever a mother breastfeeds her child, oxytocin acts on her limbic system. Limbic system, which is a part of her hypothalamus, which we have done. और limbic system में होता है an area for emotions, emotional area, and hypothalamus के limbic system के emotional area पे act करता है oxytocin and brings about emotions of the mother for the child, and she develops a strong motherhood bonding for the child. So oxytocin brings about emotions, a feeling of love. Love is brought about by oxytocin, and it's exactly called as the love hormone. And as a matter of fact, love not only of mother for the child. If you see a girl and you start developing an attraction for her, you love her, you begin to love her, which hormone is secreted by your pituitary gland? Oxytocin. So all the love is oxytocin. तो याद रखना दो हार्मोन है, libido, lust is testosterone. Emotions, love is oxytocin. तो ये दो emotional feelings होते हैं if you are emotionally attached to someone. That is love. That is done by oxytocin. If you are sexually attracted to someone, a lust, then that is done by testosterone. Beautiful logic. Yaad rakhna, nice point here. And then we have a hormone called as coherine, which is not given in your NCRT. scientists are also not sure of this hormone, but I'll just teach you, is supposed to have prolonged rhythmic contraction of the jejunum. तो jejunum of the digestive system में rhythmic contractions for peristalsis are brought about by coherine. Coherine helps in peristalsis in the jejunum. So this is your 10th hormone. If you remember, अब तक हमने 9 किए थे. This is your 10th hormone, coherine, but scientists are still not sure of this hormone. Very little is known about this hormone. So just for knowledge, not given in the NCERT. And hormone of the pars intermedia, well, we have done that already. Melanocyte stimulating hormone, MSH, also called as intermedine. MSH, also called intermedine, because it's given by pars intermedia in lower group of vertebrates like fish and amphibians. Fish and amphibians may, it helps in the darkening of skin, helps in production and dispersal of melanocyte or pigment cell. So pigmentation, melanin production is done by MSH in fish and amphibians. And I told you the fact, in animals, the function is not known. Skin pigmentation in humans is controlled by ACTH. That is the truth. But we follow the NCERT, pigmentation in animals is controlled by MSH. ये NCERT में दिया है. So MSH controls our pigmentation, and that is what we remember. So we have done in tremendous detail the entire pituitary gland. What a gland. So many functions. Absolutely fantastic logic. Chalo, I hope you have understood this, all of you. See ya. Bye-bye.